My name is Veronica Okoye. I'm a family nurse practitioner and a Doctor of Nursing Practice candidate at Wagner College. This presentation is to educate the public of a known global health issue, malaria, addressing the challenges and the solutions. These objectives in this presentation aim to provide a comprehensive understanding of malaria as a global health issue, covering its epidemiology, clinical aspect, diagnostics, treatment, prevention, and the broader impact on health systems and the community. What is malaria? Malaria is caused by a single-celled parasite of the genus Plasmodium. Malaria is a life-threatening disease spread to humans by female Anopheles mosquito feeding on humans. 5 species of this parasite can infect humans. It is mostly found in tropical countries. It is preventable and curable. Global burden of malaria. According to the latest World Malaria Report by World Health Organization (WHO), malaria is prevalent in many parts of Africa, Asia, and Latin America, with sub-Saharan Africa bearing the highest burden. Malaria transmission. Female Anopheles mosquitoes spread malaria to people through their bites. People are also at risk of contracting malaria via transfusion and use of contaminated needles. Plasmodium parasite life cycle. If the mosquito carries malaria parasite, so-called sporocytes are released into the skin during feeding. From there, they rapidly migrate to the liver, where they invade liver cells and multiply extensively. After about 10 days, tens of thousands of daughter parasites emerge from the infected liver cells. Each rapidly invades an erythrocyte, a red blood cell, initiating what is known as the asexual multiplication cycle. The asexual multiplication cycle, which takes 48 to 72 hours to complete, depending on the species of parasite, results in the creation of daughter parasites that can invade yet more erythrocytes. After some time, some of the parasites transform into gametocytes that can infect blood-feeding mosquitoes, thereby completing the life cycle. Parasite multiplication in the blood continues until patient is either treated or die, or until the immune system is able to control the infection. Effect of malaria. Because some malaria symptoms are not specific, getting tested early is important. In areas with high transmission, the most vulnerable group are young children who have not developed immunity to malaria yet, and pregnant women whose immunity has been altered by pregnancy. Symptoms can be mild or life-threatening. Mild symptoms are fever, chills, and headache. Severe symptoms include fatigue, confusion, seizure, and difficulty breathing. Some malaria symptoms are not specific, therefore getting tested early is important. Complication of malaria. If malaria is left untreated, it may lead to complications such as swelling of the brain or brain damage may occur. In some cases, cerebral malaria may cause coma. Malaria can cause accumulation of fluids in the lungs, which can make it difficult to breathe. Malaria can cause the kidney and liver to fail or spleen to rupture. Malaria damages red blood cells, which can result in anemia. Any of these conditions can be life-threatening. Diagnosing malaria. Early diagnosis and treatment of malaria reduces disease, prevents death, and contributes to reducing transmission. WHO recommends that all suspected cases of malaria be confirmed using parasite-based diagnostic testing. Malaria treatment. Healthcare providers will prescribe malaria medicine based on the type of Plasmodium parasite that caused the malaria in the individual, and then they're sensitive to medicine and the vulnerability of the individual. These are the most common medicines for treating malaria. Malaria is a serious infection and always requires treatment with medicine. Most of these medicines used are in pill form. However, some people may need to go to a health center or hospital for injectable medicines. Malaria prevention. Malaria can be prevented by avoiding mosquito bites and by taking medicines. Talk to a healthcare provider about taking medicines such as chemoprophylaxis before traveling to areas where malaria is common. Lower the risk of getting malaria by avoiding mosquito bites. Vector control is a vital component of malaria control and elimination strategies, as it is highly effective in preventing infection and reducing disease transmission. Consideration for chemoprophylaxis. The primary healthcare provider will determine which chemoprophylaxis drugs are appropriate for the country of destination and the resistance pattern of the malaria parasite in that region. It is essential to start chemoprophylaxis before entering a malaria endemic area and continue for a period after leaving to cover the incubation period of the parasite. In some cases, chemoprophylaxis drugs must be started 2 to 3 weeks before departure. All prophylactic drugs should be taken on schedule for the duration of the stay in the malaria risk area and should be continued for 4 weeks after the last possible exposure to infection, since parasite may still emerge from the liver during this period. For drugs like primaquine and tefenoquine, it is crucial to test for G6PD deficiency to avoid hemolytic pneumonia. Monitoring for side effects is necessary to ensure adherence to medication regimen and manage any adverse reaction. Preventative chemophilaxis malaria drugs. Travelers to malaria endemic areas should consult their healthcare provider several weeks before departure. Malaria vaccine. Since October 2021, WHO has recommended broad use of malaria vaccines among children living in the region with moderate to high Plasmodium parasite malaria transmission. The vaccine has been shown to significantly reduce malaria and deadly severe malaria among young children. In October of 2023, WHO recommended a second safe and effective malaria vaccine. The availability of 2 malaria vaccines are expected to make broad-scale deployment across Africa. Challenges in malaria control. Progress in global malaria control is threatened by emerging resistance to insecticides among Anopheles mosquitoes, as described in the latest World Malaria Report. Other threats to insecticide-treated nets include insufficient access, loss of nets due to the stresses of day-to-day life, outpacing replacement, and changing behavior of mosquitoes, which appear to be biting early before people go to bed, therefore evading exposure to insecticides. Economic and social impact of malaria. Malaria is a poverty disease. Malaria imposes substantial costs to both individual and government. Scarce resources and socioeconomic instability has hindered efficient malaria control activities. Costs to individuals and their family include purchase of drugs for treating malaria at home, expenses for travel to and treatment at dispensaries and clinics, loss of days of work, absence from school, and expenses for preventative measures. But as living standards and economic capacity improve, the disease disappeared from most of the area where it was already at a biological disadvantage for climate reasons. Global effort to combat malaria. The WHO, in its latest update in 2021, has provided a technical framework for all malaria endemic countries. It is intended to guide and support regional and country programs as they work towards malaria control and elimination. Success stories. Countries with zero indigenous cases for at least 3 consecutive years are considered to have eliminated malaria. In 2021, the Islamic Republic of Iran and Malaysia reported zero indigenous cases for the fourth consecutive year. Additionally, Belize and Cabo Verde reported zero indigenous cases for the third time. China and El Salvador were certified malaria-free in 2021, following 4 years of zero malaria cases. Future direction in malaria control. Improved surveillance of malaria cases and deaths help ministries of health determine which area or population groups are most affected and enables countries to monitor changing disease patterns. Strong malaria surveillance system helps countries design effective health interventions and evaluate the impact of their malaria control programs. In conclusion, malaria remains a major global health issue with significant impact on health, economies, and societies. The fact that the decline in malaria prevalence or malaria-free in some countries has given many people renewal hope. Furthermore, the introduction of two malaria vaccines are the latest weapon being used to prevent malaria with the hope that malaria will eventually be a thing of the past. This slide is the link to more information from CDC and World Health Organization, WHO. This concludes my presentation on malaria. I hope you have found the information informative. For any questions, please feel free to contact me at email below. Thank you so much for watching.